I wanted to explore the prevention side of Ayurveda a little bit more with you. Um, I was thinking that how can it help individuals who already have a higher baseline of developing cancer? For example, women with germline BRCA1 mutations who have a very high risk of developing breast cancer or ovarian cancer. So how does prevention, the prevention aspect of Ayurveda help in that case?
Yes. Actually, this is a very interesting area because Ayurveda has a great hope for these genetically predisposed patients. We
Okay.
have our one project for these patients
Mm,
in collaboration with Dr. Rajiv Sarin, who
mm,
is the head of the genetic department at Tata Cancer Center.
mm,
So what we are doing that we are identifying the patients who are breast cancer patients or ovarian cancer patients, that is HBOC patients
mm,
with BRCA1 and BRCA2 mutation. We are
mm,
starting them Ayurvedic treatment, and at the same time,
mm,
we are doing counseling of their relatives
mm.
who are BRCA1 and BRCA2 positive,
Okay.
but yet not developed cancer. It's
Mm,
a long-term project, but we are giving diet guidelines
mm,
and lifestyle modification guidelines. We are advising them panchakarma treatment and specific rasayana medicines which they can take for a longer duration. And we are observing these patients with periodic investigations. So, yet we have a data of some, not we cannot say them patient, some people who have such type of genetic predisposition.
mm,
And what we have observed that yet they have not developed cancer. And additional benefit is that with all this Ayurvedic holistic approach,
mm.
their general condition is improved. They are not suffering from the diseases which generally other people of their age are suffering from. So this is an additional advantage. So for predisposed population, the Ayurveda is the great help as these medicines are safe, these medicines are essential to improve their immune system and thus to prevent the primary development of cancer.
Yes. Because otherwise, these women have to get their breasts removed as soon as they know that they have a germline mutation. Some people, through genetic counseling, they also decide to get, and that's a very heavy toll on the mind of
Yes,
the patient. Uh,
yes,
right. So, if
yes,
Ayurveda can do anything,
yes,
then it will be a very, very big
yes,
achievement. So, one more aspect that was coming to my mind was stress related issues. So, chronic stress, it's known now that scientifically also chronic stress can affect hormones, immunity, inflammation, and stress is a very big risk factor for cancer. And different people have different baseline levels of stress as well. So, what does from an Ayurvedic perspective, how do we understand stress and how can it influence disease?
yes. This is a very good question. Always our mentor, our sir, Dr. Deshmukh sir, is asking us one question that Indian women, they are not having addictions. Most of the Indian women, 99% women,
Yeah.
they do not have addictions. But
Mm,
still there is a high rate of breast cancer. Why it is so? Because addiction is said to be very important cause of any type of cancer.
mm,
But the main cause of breast cancer in Indian women is the stress factor. Now, there are other reasons, but the additional reason is the stress. Because in females, especially, they have multiple types of stress, like family stress, social stress, or if they are doing any job, then job related stress. So, at the same time, they are handling many stress factors. So, this is very important cause of increasing trend of breast cancer in female patients.
mm,
And in this respect, at our center, we have done two studies. One study was done by my colleague, Dr. Vasanti Godse. Her PhD topic was to find out the causative factors or risk factors in breast cancer patients. And she have assessed the mental situation of these patients.
mm,
She have taken the complete information about addiction and complete information about their menstrual cycle. And in these three factors, what she has found that mental stress is the very key factor, important key factor in development of breast cancer patients.
Mm,
And on the basis of that, what we have done, that in especially in triple negative breast cancer patients, because this cancer is developed at very early age,
yes.
these women have a lot of stress in their working place or in their family. So
Mm,
what we have done, we have added a treatment called as Shirodhara in their normal regime. And we
okay.
observed that Shirodhara, that the procedure which is relieving mental stress, is highly effective in these patients. One of our student, PhD student,
Mm,
have done her PhD on the same topic,
mm,
and we are giving the Shirodhara of Jatamausi tel to these patients, and additionally, counseling also helps a lot in these patients. My colleague who has done this work, Dr. Vasanti Godse, she is doing counseling to breast cancer patients and other patients also who are under stress. And it is observed that once the stress is less,
mm,
they accept medicine more effectively, they become more positive, and the survival definitely increases or extended in these patients.
mm. Have you looked at the mechanisms of this and some of the biomarkers related to stress in these studies?
Actually, we have not done biomarkers. Now our next study is planned on that.
Mm. Okay. Okay, so it's good that you've started discussing some of the research work that you've done, and I was about to ask you from your papers and clinical work, it is clear that you have used a wide range of Ayurvedic interventions to support cancer patients. So, my next questions would be about that. I'm going to ask you to describe each intervention in a way that is it's easier to for our Western audience to understand and also our non-Ayurvedic audience to understand, and then explain how that intervention is relevant in cancer care in your experience.
Yes.
So the first one is you've used a variety of marine Ayurvedic drugs as well and Shank Bhasma. So can you explain their relevance in cancer and what that is?
Yes. Ayurveda describes many types of medicines. One category is herbal medicine,
Mm,
another is marine drugs, or we can say mineral medicines, and third category is metallic medicines. In our practice, we are using mineral medicines,
mm,
especially in side effects of chemotherapy. So there are very well-known Ayurvedic medicines called as Kamadudha, Mauktik Yukta Kamadudha, and Praval Panchamrut. So this Praval Panchamrut is a completely marine drug. It contains Shankha Shukti Bhasma, Mauktik Bhasma, Praval Bhasma, and Kapardik Bhasma. So all these five are marine medicines which are originated in sea or originated in marine origin. And these medicines have a great capacity to improve your digestive power, to minimize or the pitta dosha which is vitiated,
mm,
which is the condition commonly seen as a chemotherapy side effects. Many patients who are under chemotherapy, they have lots of side effects related to gastrointestinal tract,
mm,
like nausea, vomiting, acidity, hyperacidity, burning in stomach, or sometimes they suffer from flatulence, constipation, or loose motions. So
mm,
these are very common side effects of chemotherapy, and these side effects can be well treated with these marine drugs like Praval Panchamrut and Kamadudharas. So we have clinically assessed the efficacy of these drugs, and we have our one publication about the characterization of these marine drugs on Shankhabhasma, and there is another publication on all five varieties of marine drugs.
okay. In one of the papers, you have mentioned Basti Chikitsa and Crumigna therapies. So what
Yes.
are they and how have you
Yes.
used them?
The concept of Krumi in Ayurveda is very different than concept of modern medical science. Charaka Savita has described one complete chapter for description of Krumi, that is in Vimanstan Vyadhitarupi Adhyay, and in that chapter he divided the Krumi in three types. One is Kafaja Krumi, that means the Krumi which are originated in abnormal kapha dosha or in kleda, that is kaphaja krumi. Second is purishaja krumi, that means the krumi which are developed in stool or which reside in stool. And third is raktaja krumi, that means the krumi which are present in blood. So this concept is a unique concept, and many diseases are seen due to the samprapti of krumi. Purishaja krumi you can see with eyes, you can see with microscope, but kaphaja krumi and raktaja krumi you cannot see. They are so minute. So how you can understand their pathogenesis? With the help of symptoms. It is clearly given in Charaka Samhita, the Sanjata Krumi Lakshana. That means the signs and symptoms of development of Krumi. And these Sanjata Krumi Lakshana are Jvara, that is fever, Vivarnata, discoloration, Shula, that is pain, Rudroga, that is cardiac problems, Sadhana, that is feeling of heaviness in the body. Jwaro Vivarnata Shulam Rudrogaha Sadanam Brahmaha, that is giddiness. So these symptoms are clearly indicating that there is a pathology of krumi. So jvaro vivarnata shulam rudroga sadanam brahmaha bhakta dvesha, that means there is a nausea, and atisara, that is loose motion. So with the help of these some symptoms, if the patient is suffering from these symptoms, not only these symptoms but associated other symptoms, you can identify that there may be a samprapti of krumi. And in many cancer patients, we have observed these symptoms as initial symptoms. In modern medical science, also, that first symptom of uh, uh, any type of cancer is loss of appetite. That is bhakta dvesha. Slowly, the patient develops jvara or fever. So, most of the symptoms resemble the symptoms of krumi. So, Raktaja Krumi and Kafaja Krumi play very important role in the samprapti or pathogenesis of cancer. So, with this concept, all the patients who are treated at our center with Basti Chikitsa are initially treated with Krumigna Basti. We have one study of Krumigna Basti in specific sets of cancer patient, in genitourinary cancer patients, in breast cancer patients. We have done the clinical assessment of all these patients, the symptomatic assessment, assessment with the help of biochemical parameters. And what we have observed, that if they are treated with such type of Promigna Basti, the symptomatology is reduced, their agni is improved, their fever is reduced, and at the same time, the hemoglobin level is increased. So, with this help, we could establish the hypothesis that Krumi is one of the reasons in developing many types of cancer.
Um, my next question is on brain cancer. You have used Raupia Sutashekara. What is
Yeah.
that?
Yeah. Actually, Raupya Suvarna Sutshekar is a medicine which is a herbo-mineral metallic medicine.
Okay.
We all know the formulation Sutashekar or Suvarna Sutshekar. This formulation is basically used for pitta disorders or the diseases of pitta dosha.
Mm.
But we have added Raupya Bhasma in that. And this formulation we have used in many brain tumor patients. In brain tumors, mainly the pathology is such
Mm.
that there is a aggravation of pitta dosha, aggravation of vata dosha, and the site is brain, which is very difficult to treat. In
Mm.
Ayurveda, it is considered as one of the important marma, important vital organ. So
Mm.
when there is a cancer in such type of vital organ, it is difficult to treat. So only with herbal medicines, it is not that much effective to treat such type of tumors. But we use this Raupya Suvarna Suchekar in cancer patients during the course of conventional treatment as well as after completing conventional treatment for longer duration. And what we have observed, that with this medicine there are very less chances of recurrence, and another important thing is that the symptomatology is very less and the quality of life of patient is improved. So all these observations are included in our patient. And not only that,
Mm.
we have used this or we have seen the efficacy of this Raupya Suvarna Soochekar in zebrafish model also.
Okay.
One of a PhD student was working in our institute on zebrafish model and efficacy of Raupya Suvarna Soochekar.
Okay. My last question with the from an intervention perspective is related to diet, um, which is a very important topic, I understand. So, you have mentioned diet in colorectal cancer patients, and there have been numerous publications on like red meat is harmful for colorectal cancer patients and excessive protein is harmful. So, can you clarify some of these things and how is diet helpful in colorectal cancer patients?
Now, regarding colorectal cancer, we have one publication, but we have seen the role of effect of diet in many cancer patients. But now I will speak more about colorectal cancer.
Mm.
In that paper, what we have done that we have assessed the previous diet history of 420 colorectal cancer patients
Okay.
who came to our center, and the common risk factors which we have observed were the two risk factors. They were the curd, that is yogurt, and red chili. And
Oh,
Ayurveda also supports the same observation that yogurt is said to be pitta and kapha dushtikara. It vitiates pitta and kapha dosha, and red chili, it vitiates pitta dosha and rakta dhatu. So both are responsible in samprapti or pathogenesis of colorectal cancer. So in not only in colorectal cancer, but when a patient is suffering from the diseases of colon, like hemorrhoids, we always tell them to quit or to stop the chili or stop the yogurt. So these two risk factors were identified in more than 60% patients who were suffering from colorectal cancer. And not only cancer, but all types of cancer. The common risk factors are
mm,
unhealthy food in
mm,
the form of viruddhana
mm.
or yogurt, or taking too much sweet food, or taking too much spicy food. So all these risk factors are identified at our center with the help of detailed case history of each and every patient.
So, having chilies and yogurt, I'm coming from a very naive perspective, but I understand that if a person is a has a pitta prakriti, then yogurt might be recommended, but chilies might not because they all already have that tendency of spiciness. So, um, can this be generalized? The yogurt and red chili,
Mm.
right? Can it be
Yes,
generalized across all the doshas?
yes. Actually, yogurt is not only vitiating kapha dosha, but it is vitiating pitta dosha also.
Mm.
So, actually, in Ayurvedic text, it is recommended that day-to-day use of yogurt is not good. It causes many diseases because it has a special characteristics called as abhishandi. It
Mm.
has a capacity to vitiate pitta kapha dosha. Not only that, it has a capacity of increasing secretions in your body, which block the channels and causes many diseases. So, in small children, if they are suffering from cough and cold, and if you will stop their yogurt, there is no need of taking medicine because only yogurt is the cause of many diseases. So Ayurveda has given strict guidelines that you should not consume yogurt daily, and there are some additional guidelines if you want to take, in which season you have to take, in how you have to combine it with other food items, so it will become less harmful. So it is not only related to cancer but related to other diseases. As I mentioned about cough and cold or in diabetes, one of the important risk factor of diabetes is said to be taking consumption of yogurt at large quantity. So not only for cancer, but for other diseases also, these food items are not recommended.
Okay. I think, okay, that was very insightful to understand all those Ayurvedic approaches and to get a very nuanced understanding of what everything means. So now we will delve into the challenges that we faced in Ayurveda oncology patient care. So, my first question is, what hinders an average patient from seeking Ayurveda as an intervention? And usually, at what stage do they come?
Actually, when we started this project 30 years back, that time the patients were coming to our center in advanced stage. Initially, they were treated with conventional treatment, and once the treatment completed, and after few years they have a recurrence, they were coming to our center. But nowadays, the mindset of people is changing. So nowadays, many patients are coming to our center at initial stage only. But it's not a research project, or it's not a completely clinical trial. But in our center, we are giving a tailor-made treatment to each and every patient. So patients are coming at various stages. So for ease, we divided these patients in four groups. A group is a group of patients who are coming directly for Ayurveda. When they are not recommended to take any conventional treatment due to old age or due to any other comorbidities, they are coming to our center for taking only Ayurvedic treatment. But the number of patients in this group are very less. B group is a group of patients who were previously treated with conventional treatment for cancer, but now there is a recurrence, and now they are opted for conventional treatment as well as for Ayurvedic treatment. C group is a group of patients who are taking Ayurvedic treatment and conventional treatment together, hand in hand. And D group is a group of patients who have completed conventional treatment. Right now, they are disease free, but they are taking Ayurvedic treatment to prevent recurrence and metastasis. So, based on different principles of cancer treatment, we divided these patients in four groups. And among these four groups, the group C, group B, and group D patients are more at our center. Those who are taking Ayurvedic treatment along with conventional treatment after recurrence and after completing conventional treatment, these three are the main areas when patients are coming to our center for Ayurvedic treatment.
So for the group C and D that you talked about, I think there is a very high chance of making mistakes when patients are coming from conventional treatments, and then there is a misunderstanding or a confusion of combining Ayurveda and with the conventional treatments because they've already undergone some of those treatments. So what is good for them, what is not, what they should stop. So what are the common mistakes that patients or practitioners make when combining both of these treatments?
See, the thing is that basically, initially at our center, we were treating cancer patients only with Ayurveda treatment, and they were taking conventional treatment outside. But from last 15 years, our center is such that we provide all treatment modalities to cancer patients. So at our center only, they are taking Ayurvedic treatment as well as chemotherapy, radiation, and surgery. So we have a good rapport with oncologist, so we can exchange our thought. So in case of treatment of patient, there is no that much difficulty from that perspective. But one mistake many Ayurvedic doctors or many doctors are doing is the common mistake that it is that I will not say it as a mistake, but as a sympathy to the patient. Many patients, they have a great fear in their mind about chemotherapy and radiotherapy, and they what they feel or what their relatives feel, that if the Ayurvedic treatment is a complete option for conventional treatment, we will opt for that. And with that idea, they come to our clinics. But at this stage, we have to convince them that Ayurvedic treatment is not a replacement for conventional treatment, it is an add on treatment right now. So, right now, you have to take conventional treatment, which is best for you, and don't worry for the side effects of radiation and chemotherapy. Ayurveda will take care of that. Ayurveda will definitely help you to minimize the side effects and improve your quality of life. So we have to suggest patient to take both the treatments at the same times. It is not the pathy which is important, but it is our goal is to treat patient. If the patient will take only Ayurvedic treatment and the disease will progress, then at that time that patient will not have any option of conventional treatment. Instead, we have to combine these two treatments, and we have to tell them that you have to do all this treatment together. So that is one mistake. Mostly patients, relatives, and doctors are also doing. And from modern medical doctors, nowadays the percentage is reducing, but most of the modern medical doctors, they think that conventional treatment and Ayurvedic treatment should not be combined. They because there is a one thought process that if the side effects are reduced, then that means the efficacy of chemotherapy and radiotherapy is also reduced. But in our center, we have treated more than 16,000 cancer patients till date with adjunct Ayurvedic treatment. And what we have observed, we are observing their long-term survivals also. So what we have observed that those who are treated with both the treatment modalities, there is no bad effect on survival. So it's not the fact that it should not be combined together, but it should be combined together and continued thereafter also after completing conventional treatment for betterment of patient.
I think more awareness needs to be generated by both I think the Ayurvedic practitioners as well as like the MBBS doctors who are there out there so that
Yes,
increase the awareness and stop this.
yes,
So you said that you give tailor-made therapies right now to the patients
yes,
that come to you. So some of the challenges that come with tailor-made therapies in my mind are first is standardization of Ayurvedic formulations on like a large scale from a pharmaceutical or regulatory perspective. And the second challenge that comes is for a clinical trial, like how would you design clinical trials if things are not standardized and they are not uniformly done?
yes. The first question was regarding standardization. But what we are doing at our center, that though we are treating patients with tailor-made treatment, all the medicines which are prepared or manufactured in a pharmacy which is located in our campus, Atharva Nature Healthcare Private Limited. All medicines are standardized. In our center, we have a drug standardization lab in which we have the high-end instruments like ICP, or we are doing we are working with GC or microdization, and there are high-end instruments in our lab. So with these instruments, we are doing standardization of all medicines which we are using in all types of cancer patients.
Mm.
So there is no worry to think about standardization of medicine in tailor-made tailor-made medicine system. That is number one. And I think your second question was regarding
Clinical trials.
clinical trials. Okay. See, actually, we have also taken four clinical trials in 2015, three on breast cancers and one on oral cavity cancer. Basically, from last 30 years, we are giving tailor-made treatment. But from my perspective, the clinical trial in Ayurvedic setting should not be started at the first end. How we design the clinical trial, that before designing the clinical trial, we have studied or we have assessed the efficacy of Ayurvedic treatment of our patients which were treated previously with varied protocols, because the treatment was tailor-made treatment. So it was not the one treatment for chemotherapy side effect, one treatment for radiotherapy side effects. So we assessed different protocols which we used in cancer patients. These protocols were different because they were offered according to the signs and symptom of the patient, according to the prakriti of patient, and what we have assessed the correlation of patient's condition and that protocol. And on the basis of that, we came to conclusion about two protocols which are more effective in cancer patients undergoing chemotherapy, and one protocol for oral cavity cancer patients undergoing radiotherapy. So a clinical trial in Ayurveda should not be initiated immediately. You should have some background work. With the help of that background work, with the help of that background experience, you can design clinical trials. But the second important thing is that it should not be done that if you design any clinical trial, you should not be hard and fast that each and every patient should be treated of that variety in that clinical trial. I'll give you one example in this case. When we designed a clinical trial of oral cavity cancer patient undergoing radiotherapy, I remember there was one patient who was in trial, who was a study group patient, but when he developed some osteomalacia, we stopped the trial medicines and we started that patient another medicines, Ayurvedic medicines, and she had very good relief. That means our study should be patient oriented. It should not be only trial oriented. That is my opinion. You can take that patient out from the trial, you can recruit another patient, but first you have to see whether the trial medicines are suitable for this medicine, for this patient or not.
Okay. My next question is, which Ayurvedic interventions currently have a very strong mechanistic or clinical evidence, and which areas lack that solid evidence, and what are the challenges in pursuing Ayurvedic research?
Actually, Ayurvedic medicines there are many Ayurvedic medicines which have great impact in various types of cancer. But I will just tell you in brief that in Bhavprakash, Gugul is said to be effective in Granthi and Arbuda. And we are also using a large quantity of various forms of Gugula in various types of cancer. For example, in colorectal cancer, we are using Triphala Gugul. In the cancers or like non-Hodgkin's lymphoma, we are using Kanchanar Gugul. We are using Punarnava Gugul in various types of cancers, especially in genitourinary cancers. So Google play important role in cancer management. That is number one. Number two, many forms of Suvarna Bhasma. I first initially I spoke on Rasayana Chikitsa, and among all Rasayana, the best Rasayana is Suvarna Bhasma. So various preparations of Suvarna, for example, Raupya Suvarna Suchekar, Suvarna Suchekar, Suvarna Malini Vasanta. These formulations are used in our practice commonly for a longer duration, for having Rasayana effect and for especially for preventing cancer. So one which I explained was Gugul Kalpa, second was Suvarna Kalpa, and third important thing or important principle in cancer management is to improve Jatharagni. So for improving Jatharagni, the medicines which are Dipana and Pachana are of much help. So there should be a combination that of Dipana Pachana medicines, medicines containing Gugul Kalpa and medicines containing Suvarna Kalpa. Then and then only the medicines are effective in preventing recurrence.
Okay. So we will now discuss the research landscape and the future scope of Ayurveda oncology. Um, what kind of mechanistic studies do you think are most urgently needed for Ayurveda to gain a wider acceptability in society and in oncology?
See, basically, cancer is a complex disease. So, it is difficult to treat cancer only with herbal medicines. You have to choose herbo-mineral combination or herbo-mineral metallic combination. And many modern medical doctors or many lay people, they have a fear in their mind that these mineral and metal combinations or medicines, are harmful for our kidney or harmful for liver. They have a liver and kidney toxicity. But this is a misconcept. If these medicines are prepared properly, as explained in our Savita, as explained in our Nigantu, there is no such toxicity. So, what I suggest or what I think that the complete standardization of all Ayurvedic medicines containing bhasmas and minerals should be done on priority so that there will be a assurance for modern medical doctors and also society that if they are prepared properly, there is no toxicity. So these standardization studies should be taken up on first priority. And for mechanistic studies, what I suggest that for mechanistic studies, we can do some animal trials like on rats or in zebrafish model. But there are limitations for these animal trials because Ayurvedic treatment is not a single line of treatment. If you want to treat any cancer patient, you have to treat that patient with the help of medicines, oral medicines, with the help of diet modification, with the help of lifestyle modification. We have to give panchakarma treatment to that patient. So it's a holistic treatment, and if we offer a holistic treatment, then and then only you will get success in cancer patients. And offering such type of holistic treatment is little bit difficult in rat models or in other zebrafish models. So I think instead clinical studies should be more encouraged in case of assessment of efficacy of Ayurvedic treatment.
Yes. My work is to do a lot with the mice models and also the in vitro cellular models and things like that. So I always wonder, like, if I'm to do any Ayurvedic study, let's say in a mice, then how will I classify a mouse into the doshas? What is the dosha of
Right.
a mouse? So what?
Right, that is the, yes, that is a drawback. Means at some level we can confirm the efficacy, but we cannot come to the final conclusion with that results, that those results.
How would you describe the current research landscape for Ayurveda oncology in India? And are there any steps that are being taken by the government or any private organizations to strengthen it?
Yes, now in India, there are many Ayurvedic doctors who are treating cancer patients, who are interested in treating cancer patients, and not only interested, but they are actually treating cancer patients in India. But apart from that, on government level, there is a move that now government is preparing a white paper for Ayurvedic treatment, not only Ayurvedic treatment, but Ayush treatment for cancer. I'm a part of that group, and they are gathering a data from complete from India, from various Ayurvedic doctors, homeopathic doctors, about their experiences in the treatment of cancer. And with this data, they are going to prepare one white paper. So this is one good move taken by the Ministry of Ayush and in collaboration with Tata Cancer Center.
Okay, that's very interesting. Um, I wanted to know your perspective now, and like just a fun question: if you can immediately pursue two research directions in your field, then what would they be and why?
You are asking about research directions, or I can speak more about clinical directions, or only research.
Anything that you would want. Clinical
Yeah.
is also.
Yes, because my perspective is that our country, especially India, is not that much rich to spend too much money on research in Ayurveda, which is already established science. So ideally, we have to treat cancer patients with Ayurvedic treatment. We have to promote more and more cancer patients to take Ayurvedic treatment. In India now, there is a large group of cancer patients who cannot afford Ayurvedic treatment. In many there are many state schemes, or there are many government level schemes which are giving free allopathic treatment to cancer patients, but they are not offering free Ayurvedic treatment to cancer patients. They are on the way of doing all these things, but I think that instead of investing too much money in research in Ayurveda, you have to treat many and many cancer patients with adjunct Ayurvedic treatment. You have to get a large quantity of clinical data, and that itself will become a research finding.
Yes. Okay. My last question to you is, what do you think Western medicine and cancer research can learn from India's Ayurvedic tradition?
Yes, I learned one thing from one very great guru, that what India can offer to the world. Only two things India can offer to the world. That number one is Ayurveda and number two is yoga. So I think yoga and Ayurveda, these two are the great medical sciences of Ayurveda. One is more related to body and one is more related to mind. So what I think, that if Ayurvedic principles are spread all over the globe, there are very less chances of pandemics. There will be very less chances of non-communicable diseases. Nowadays, all over the globe, we know the proportion of non-communicable diseases, like for example, cardiac diseases or arthritis or diabetes, blood pressure, cancer. The percentage is increasing globally. So we have to, at some point, all the global medical fraternity should come together, and they have to sit with Ayurvedic physicians to prevent this scenario. And Ayurveda is the best science which can have a capacity, or which has a capacity to prevent this global status, because Ayurveda mainly focuses on prevention of the disease. Nowadays, we are not following any dietary rules. All these junk food or abnormal lifestyle, or Ayurveda says you have to take only 2 or 3 times food. You have to take homemade fresh food. You have to go to bed early at night. You have to wake up early in the morning. Among all these rules, we are not following a single rule. And how we will expect that our health should be good? So all these principles of Ayurveda should be followed properly. The important Rasayana Chikitsa and Panchakarma treatment, which is recommended not only in diseased person, but in a healthy person to maintain health. If these treatment modalities are spread in the world, or if they are spread globally, I think the global health will really improve.
Mm. I was reading recently that PM Modi has introduced Ayurveda in the CBSE syllabus. Uh,
Yes,
Okay, so that was very happy news because I feel like
yes,
if students from a very early age, because they're so moldable, if they can learn about these sciences, and they can also think about the various ways, like what are the things, what are the gaps, what can we
yes,
do? Because right now, until I completed my degree, I was not aware of like I can also pursue Ayurveda, because like we are told either you can become an engineer or you can become a doctor, which is like from a modern perspective, but not Ayurvedic. But I developed somehow. I felt like I have some connection. I kind of developed some interest, and I started started reading more about it. But this is not the case with others. I feel like they need to be introduced to these sciences so that they can
yes,
adapt. They can notice for themselves that these things have a change in their routine, in
yes.
their way of life, and everything. And then they can also do something on like in the future if they want to pursue these fields, because like the more and more people pursue this, the more and more change we'll be able to make.
Yes. And basically, the children should be aware about this thing. And if it is included in their syllabus, slowly they will come to know that what to eat, how to plan our lifestyle. So that will be a great help for society.